Welcome to the Cancer Answers Global Summit. I'm Jean Swan, and in this edition we'll be exploring what causes cancer and what we can do to actually outsmart cancer so that we never develop the disease. With statistics being as high as they are, as we've spoken about through this whole series, we all have to educate ourselves. We all have to be proactive. We have to know the strategies that can prevent a disease like cancer, or any disease from that matter. And with us today is an expert in cancer, Dr. Nalini Chilkov, who is a doctor of Oriental medicine and author of 32 Ways to Outsmart Cancer, Create a Body Where Cancer Cannot Thrive. So we're going to learn all the things that you can incorporate into your daily life so that you can increase your health, avoid disease, increase your longevity. Dr. Nalini, so nice to have you with us.
Thank you so much, Jean.
Now, let's define for people, because the word cancer just creates a lot of fear in people. People, for the most part, still think that it's a death sentence when we have so many options now, which is what the series is about. But can you define for us what happens to the body actually when someone is given a diagnosis of cancer?
Well, the first thing I like to say is a cancer diagnosis is not an emergency. So let's get that out of the way right at the beginning. It's a journey, it's a process, it's a challenge, but it's not an emergency. Cancer cells have been in your body 10 or 20 years by the time a tumor is found. So if you take your time to decide what to do, it's not going to really change your outcome. So I like people to take a deep breath at the beginning. And so to understand what cancer is, at the very beginning, your DNA, your genetic material, will be damaged. That could be from a flying electron, that's oxidative stress. It could be from a chemical damage. It could be that your immune system failed you. So the first step is that the DNA, or the genetic material, gets damaged. And that's really like the software in your cells that tells your cell how to work. And when that goes haywire, then a cell will be abnormal. And then that cell will divide and divide and divide. And it actually takes about 1 billion cells for a tumor to be seen. So that's a lot of cell divisions, and it takes time for that to happen. And so one side of the cancer equation is that these are cells that are dividing out of control. But that's really only one side of the equation. The other is that healthy, normal cells know when to die, and that's called apoptosis. That's normal cell death. So if you have a cell that's no longer viable, an intelligent system will recycle it. But cancer cells have learned how to survive, and so they're almost immortalized. And that's really what cancer is. So our therapies, when we think about how to control cancer, we want to protect the DNA, protect our genes from that damage, but then we want to be able to control that growth and also turn back on that signal so the cell recognizes it's not a healthy cell and it dies and recycles itself.
And I think it's so important that you mention it's not an emergency, because you hear story after story after story of cancer survivors and thrivers who've come out the other side, but who tell stories of how they were rushed. We need to do surgery tomorrow. We need radiation tomorrow. They're filled with so much fear and panic. They're afraid that they won't survive if they don't do it. That's very common.
It's very common, and I actually really object to the fact that oncologists, not all oncologists, but many, will almost manipulate their patients with fear. And that's not fair, number one, because no one should make a big life decision in that state. And so if someone comes to me as soon as they were diagnosed, the first thing I say is take your time. Make sure it's your decision. You don't have to be rushed. And think about it. You want to get your family in order, your kids covered, your business covered. You want to make sure you feel good about the decision you've made. And then you're in alignment with yourself and with your care providers so that you have a real partnership and a better outcome.
And it makes sense, as you described, it takes so many years and so much has to happen to get to the point of having cancer. Why would one day make a difference? I mean, you know, you have time, which is really reassuring.
Yes, so the only time you would have any urgency is if, like, you're bleeding, right? And then you would be hospitalized. You could control the bleeding, but you don't have to jump into treatment until you have a really thoughtful plan. And there are many choices, and you want that plan to be highly individualized to you. And so a lot of cancer care is very cookbook. If you have this diagnosis, we'll give you this cocktail. And that's really not right, because today we know that even in breast cancer, there are breast cancers. And so that cancer is occurring in a unique body with unique environment, unique genetics, and therefore every cancer is actually different, and every patient should get individualized care. And if you're an educated patient, you can ask for that.
And that's another important key, being educated, which is what this entire summit is about. Learn your options. Not every doctor that's speaking has the particular answer for you. However, they would create an individualized treatment for you. So becoming educated, and hopefully becoming educated before cancer starts, which is what your book is about. 32 ways to outsmart cancer before it can ever enter your body.
Well, we have to think about whenever somebody enters this journey, right? So ideally, we want to protect ourselves from ever getting cancer, but there are people who want to protect themselves from getting a recurrence, or sometimes people are in the middle of cancer treatment, and at all those phases, the question arises, what can I do to change the course of my journey?
So how do we begin changing that course? We're talking about changing the environment of the body so that cancer couldn't survive. And it's said that cancer can't survive in an alkaline body, first of all, right?
Well, I slightly disagree
sometimes
with that.
That is a saying that I've heard. But then as I'm saying that, I just realized there was someone who told me recently they had an alkaline cancer. So I guess there are exceptions to that.
Well,
you can explain it.
It always has to be individualized, number one. But this might be very controversial, but I'm going to say it. There are ideas in the sort of natural cancer world that are outdated and aren't really rooted in science. And so one of those is sort of that about alkalinity. So the body has a normal alkaline acid balance. And if your body goes outside of that, you're going to be in the hospital because you can't survive. So what is true is that if you eat more alkaline foods, you'll have less inflammation. That's what's true. But you can't alkalinize the entire body outside of normal. You can't do that because then you wouldn't have normal function. So it's very important to understand that the environment around a tumor is more acid, but that doesn't mean the whole body is more acid.
Right. So is it true that if you keep your alkalinity at about 7.4, that's good? Like when you use those strips?
Well, the saliva and the blood and the urine all have their normal pH. And so you want to be normal for whatever body fluid that you're testing. There was a very famous Dr. Ravici, who's no longer alive, who had all of his patients check their urine pH and would monitor whether or not their physiology was properly managed by doing that. And that's an easy thing to do at home.
Right, so that's something people can monitor to prevent cancer. As far as diet and lifestyle changes, let's start with, your daily eating habits. I know you have a great newsletter that you send out with delicious recipes all the time. So there are cancer-fighting foods and recipes that people can create on an ongoing basis and really create a healthy internal environment. Can
Absolutely.
you share with us some of those key points?
Well, everybody has to eat every day, so what you choose has a big impact. Really, how we live has the biggest impact, more than anything in a bottle. And so the first principle of an anti-cancer diet is really lots of color, right? Lots and lots of color, because all of those colors and pigments in fruits and vegetables and plant foods are actually plant chemicals that enter the nucleus of your cell and turn cancer genes off or on, right? So you actually could control your gene expression by what you eat. So that's what matters, what you eat. Also, you really want to be sure that you have an organic diet that's free of chemicals, free of herbicides, pesticides, hormones, antibiotics. You want to make sure that you're not adding chemical load to your body, not adding hormones to your body, because these are the big drivers of these changes in our cells. And we're not biologically designed to deal with that kind of chemical load. And so the things you have control over, take control over those. So that would be drinking clean, filtered water, and also organic, clean food, wild-caught fish, free-range chicken or beef if you eat animal products, and making sure it's also fresh. I mean, one of the best ways to just clean up your diet is to stop eating packaged food. If you do that, all of a sudden a lot of chemicals are out of your diet, and if you're eating fresh, whole foods, you're getting whole, vibrant, complete nutrition. The other thing really is to be on top of your protein. A lot of people, when they start to eat healthy and kind of take meat out of their diet, they will stop eating enough protein. And you really need a lot of protein to have a robust immune system. And if you're going through a surgery or cancer treatment, you need that rebuilding nutrient. So about 60 grams of protein a day minimum, and 20 grams is a serving. It's about the size of your palm, or about 4 ounces.
So what about people who, for spiritual or other reasons, choose to be vegan or vegetarian? Do you find some good plant-based proteins for them?
Well, you don't have to eat any animals to get enough protein. So, and it's true that plant-based diets are diets that give lower cancer risk. That is absolutely true. But you don't have to be a vegan or a vegetarian to eat a healthy diet either. There's a lot of ways to be healthy, so that should be emphasized. And in the plant world, the source of protein primarily will be legumes and beans and the things we make out of those. And nuts and seeds have some protein, but they're really more a source of fat.
Now, you touched on something before, that our diet can either turn on the expression of our genes or off. And this is a really important topic, as many people, especially after Angelina Jolie had a double mastectomy because she had inherited the BRCA1 gene, that and many people followed suit, thinking that a mastectomy or double mastectomy would be the answer to preventing cancer. So it really brought up the public consciousness about the issue of genetics and epigenetics, which the majority of people don't know, because they don't talk about that in mainstream media. They just tell you what Angelina Jolie did. But the real story is epigenetics, which have proven that we can control our cancer, our genes rather, by our choices.
Well, let's also get clear that the BRCA1 gene is 5% of all breast cancers. So most women that get breast cancer, 95% of all women who get breast cancer, don't have that kind of breast cancer. And that is a fairly lethal cancer. And remember, she watched her mom die at 35. So there's always an emotional reason that we make most of our decisions also. The BRCA1 gene is a very aggressive type of cancer. But it's interesting. Statistics show that mastectomies don't necessarily have a big impact on survival for most women. And a lot of women get mastectomies, meaning your whole breast is removed and some muscle comes with that, and a lot of women don't realize what a rough surgery that is to recover from and get your upper body strength back and your whole body image is changed. So today the trend in cancer care is to not recommend mastectomies, because not only are they disfiguring, but they don't really change your survival. And so it's a very traumatic, difficult surgery. So that's important for women to understand. If you're in that 5% of women who have these genes for super aggressive, lethal cancers that women die of young, then there's a conversation to be had. But 95% of women probably don't need mastectomy. So that's very, very important.
Yes, and the fact that we inherited the gene does not rule our destiny.
That's right.
The choices that you're talking about will either turn on that tendency in that gene or turn it off. So if you have inherited the cancer gene, but yet you're eating the way you're talking about, then the chances are really not high that you will have cancer.
Well, that's very true. So I'll tell you two things. One is the BRCA genes are about poor repair of damaged DNA. And so people who have that can't repair the damage, and so their cells go haywire and turn into cancer cells faster than yours and mine. And so that's important to understand. The other thing is there's not one cancer gene. Cancer is complex and it's driven by a multiplicity of factors. So it's not just one thing. So you could have the gene, but if you have a diet really rich in antioxidants, you'll have less DNA damage, and so you won't have as much to repair. So there are ways to counter that. And I have a very personal story, actually. The way I got into this is both of my parents had more than one episode of cancer each, of different types of cancer, when they were in their 50s, younger than I am now. And so I realized that our family had a lot of risk factors. And so I was going to be the experiment to see if I could not live out my genetic potential. And so now I am older than my parents when they were diagnosed originally. And by the way, they're both alive at 87 and
wonderful.
89.
Wow.
Okay? And so you can also change what happens. But I have no signs of any of the diseases that run in my family, including cancer, right? So I'm the experiment to show you don't have to live out your genetic potential. It's only a potential, it's not your fate.
Wonderful, and that is so inspiring for so many people because there's way too much fear surrounding cancer.
Yes, yes.
And there are options, there are solutions. I mean, you have people coming to you in all stages of cancer, and do you find that usually, I mean, not in every case because some people are too far gone, but for the most part, you're able to help turn it around with people when they make lifestyle changes in addition to the modalities that you use?
You know, it takes a lot of engagement and commitment to do it. So you have to be willing to change your lifestyle, change your habits, be really on purpose and focused with very specific herbal medicines and nutritional supplements, and really control your environment, get enough sleep, get enough exercise, manage your stress. So it's a very certain kind of person that engages really fully. And my patients who are all in 100%, they show us what's possible. I have a patient with a cancer called uterine sarcoma, which is a cancer of the uterus, the womb, that is in the muscle part of it. And it's considered an untreatable cancer in oncology. And this patient came to me because she'd had surgery, which is all they do, and then she started to have a recurrence. So we did a very aggressive plan of herbs and supplements. But this woman is an all-in patient, and she does whatever I ask her, no matter how hard it is, and she really loves life. And so she has not had a recurrence, and she really should not be alive.
Wow. Yeah, it's so inspirational. So people really have to have the will to live.
You have to love life, number one. People with good support systems do better. But you have to show up also for what's on your path and chew the food that's on your plate and meet what's before you. So there are different stages of the journey. So sometimes people walk in right when they're diagnosed. That's my favorite time because then we can put this kind of health model in place right at the beginning, which is really, I think, should be in the oncology setting, but it's not. You have a disease expert, you have an oncologist, but you need a health expert if you're going to get to health. So I think it's really important for a cancer patient to build a team, really important, and to have this idea of how am I going to stay healthy, protect my healthy organs as I go through this. Then there's the stage of treatment, which is really stressful for most people, but some of my patients just sail through it and don't have the side effects because we manage them, right? So I have patients go, I'm not going to do that, I'm not going to do that. But I'll ask a patient, do you want to see your grandchildren grow up? So what's the way we get there, right? And so I am not anti-oncology. I am truly pro-integrative and ask the question, what's the right tool for the job here? And how do we buy you as much time as we possibly could and a good quality of life? And so then there's the recovery period, and then hopefully there's the period where you're just, life isn't about cancer anymore.
Right. And so people come to you and you may together decide that there is need for low-dose chemotherapy, maybe there isn't. So you're bringing together the best, and I think that's important because some people who completely dismiss all conventional medicine, they may be in need of that. In some cases.
That's
so
right.
we can't dismiss it, but what we need to do, and what I love about what you do, is that you bring it all together. Here are all of the options.
That's right.
We choose what's best for that individual, and that's how people heal, and that's how they have the best hope of recovery.
I think so, because it's complex. And being rigid and dogmatic in any camp, it narrows your universe of choices and possibilities. So if you can just be open to everything and really become informed about your own cancer and all the treatment options, and then have someone who can help you make a well-informed choice. And that usually isn't part of the process.
Right. And In conventional medicine, it usually isn't part of the conversation. That's why it's inspiring for people to know there are other options, even with the type of help and guidance they can get, the options they can have.
Sometimes I'll call up the oncologist and say, I don't think that this chemotherapy treatment is the right direction to go for this patient. I'd like to see the care be more individualized. Therefore, I'd like to do some testing that's not routine, but that will help us answer that question. And the really forward-thinking oncologists are on board with that.
Well, there are tests to show which chemotherapy would be best for that person, but they're not done generally in conventional medicine, right?
Well, if you're early in the process of cancer, sort of because of the way insurance controls treatment, the oncologist doesn't have a lot of choices and has to do what's called standard of care. But you can argue against it if you have a good argument, and so that's my job, to say, we should reconsider what we really want to do with this patient. And patients come to me also having gotten different opinions and need help sorting that out. But patients also come with 2 shopping bags full of herbs and supplements and going, should I be taking all these things? And so some people kind of get into a kitchen sink approach and think they have to take 50 different things, but what you just need is a complete plan for you. And so I think of it like a wheel with many spokes, and each spoke is an aspect of cancer physiology and a part of the plan we need to include. But we don't need 10 things on each spoke, right? We just need a complete plan that's tailored to you.
Speaking of herbs and supplements, what are some that you would recommend? Well, in cancer treatment, it's individualized, but for people listening who want to outsmart cancer,
Yes.
What are some of the general ones that we should all be taking?
Well, here's the metaphor I like to use. So you really build healthy soil when you plant a garden, and you put lots of nutrients and you make sure the soil's not contaminated. In the same way, we want to build an internal environment, that's the soil in which our cells grow, so we grow healthy cells and not cancer cells. And so that's a nice metaphor. I think it's quite understandable. And so what do we do to create an environment like that? So there's some basics. That's a foundation that's important to everyone. So we start there, and a good multi is very important because none of us eat perfectly every day. And if you have cancer risk, that multi should be free of iron and free of copper, because both of those minerals can drive cancer growth. Vitamin D is one of the most important nutrients to create this environment that's inhospitable to cancer. And you want to monitor your blood levels with that to make sure you're getting the right dose for you. Then we want to have some omega-3 fatty acids. That would be most typically your EPA, DHA. These are found primarily in fish oils, but also in flax seeds and chia seeds and some in walnuts. And these are anti-inflammatory. Controlling inflammation is super important. But also these oils have some anti-tumor effects themselves. And then for women, I want to make sure that we have bone minerals, calcium and magnesium, in highly absorbable forms, and then some probiotics or some fermented food, a source of healthy, friendly bacteria. That's like the ground. That's the basis. And then there's a couple of things that are really target cancer. So that would be curcumin, which comes from turmeric. Curcumin gives that bright yellow color to curries and to turmeric. And this interacts with over 100 different genes. So you're actually getting a lot of mileage when you use plant medicine. Another really important family of plant chemicals is sulforaphanes, and that comes from the cabbage family. So you can add broccoli and broccoli sprouts and kale to your diet, or you can take a little capsule of sulforaphanes if you're not going to eat those vegetables regularly. Also, mushrooms are incredible. So the little mushrooms we put in our salads, but also the great medicinal mushrooms of Chinese medicine. And these are rich in polysaccharides and beta-glucans, which are immune modulators. They change how our immune system works. They dial down inflammation, and they also help us manage our blood sugar and insulin. And that's very important to creating this anti-cancer environment.
Yes, the medicinal mushrooms are wonderful, and something that's not really commonly spoken about, but something that can be so easy to incorporate into your lifestyle, to put these
Yes.
capsules, or do you recommend making teas?
I recommend whatever somebody's willing to do, but there's a lot of options, right? So some people don't like to swallow capsules. You can open them up and put them in a shake. That's a nice way to do it, or mix it into a little yogurt or applesauce. You can even put some of them in soup. There's a beautiful tradition in Chinese medicine where you make these medicinal soups that have medicinal herbs in them, and the ones that don't have bitter taste, you just get this medicinal soup. Another thing to think about is bone broth, which has become very popular, and it's so nourishing, it's so healing, particularly to the digestive tract. So you want to think about what are really nutrient-dense foods, so that every time you eat, you're getting lots of nutrients.
I'm wondering, being a doctor of Oriental medicine, what aspects of Chinese medicine do you bring into your treatment of cancer patients? For example, I know that each organ is correlated with an emotion, like lungs correlate with grief.
Yes.
And then there are the four seasons and the elements.
Yes.
So how do you bring that into your work with patients?
Well, I think the lens of Chinese medicine is just beautiful and elegant. And it's really based on this idea of asking the question, where's the center? Where's balance? So then, as the clinician, we're looking at where is the person out of balance. And looking through the lens of the meridians or energy pathways and the organs as described in Chinese medicine helps us understand where a person is out of balance, and therefore how we restore them to balance. And again, the treatments themselves might also create unique imbalances. And so an example in the language of Chinese medicine is we might have things that are due to excess heat. So then we would choose cooling herbs and cooling foods. Mm-hmm. On the other hand, chemotherapy is said to be very cold for the digestive tract and really ruin the digestive fire. So then we want to use warming things like ginger and cinnamon and encourage a person to eat mostly warm-cooked food during chemotherapy so they can maintain healthy digestion. So it's an elegant, beautiful model.
It really is. I love Chinese medicine and always found it so fascinating. And it really does delve in. And the fact that it can really be so specific about, which organ you have the cancer, the tumor in, and what that correlates to emotionally. It's like a diagram in a sense to give you the clue and to give the patient the clue as to the emotional genesis of the problem.
Absolutely. And, every person has a doorway in. Right? And so because Chinese medicine is so layered, there is a way in to each person to understanding themselves, right? And so many cancers affect the liver, and so the liver has a lot to do with frustration and resentment and anger, and the liver meridian runs right through the breast. And so a lot of women are conditioned and socialized not to express those feelings. And so we would say in Chinese medicine that meridian becomes obstructed and congested. And therefore part of the treatment is to open that up, but also to allow the woman to find a way to be with those feelings that is natural and healthy.
Right. So you incorporate that conversation then with the patient as far as the emotions, because it's so crucial. And do you find that most people are at all aware of the emotional correlation to their disease, or is it a surprise, or once you mention it, does it all kind of do the dots connect for the person?
Well, when someone reflects to us and we feel seen and understood, something happens, right? No matter what the lens is, something happens. And then there's more space to grow and change in. And so if I listen deeply enough and create an environment in which someone will reveal themselves to me, then that opportunity is there. But I have to respect some people don't want to go there. Right.
Can you find that without dealing with the emotional issue, is it more difficult to heal? I mean, do you find that to be a key piece that if a person doesn't want to address, you can't force them to? However, how does that affect the healing?
Well, this speaks to what is healing, right? What does it mean to be an integrated person? Mm-hmm. So in order to be a truly integrated person and have real wholeness, we have to be able to face all parts of ourselves and grow. And so people come in the door with different degrees of openness and a readiness to do that. So maybe they'll heal their body, but they won't heal their emotions or their spirit. So that work may come later for them, or it might not come at all. Everybody gets sick, so at the moment that they walk in my door, I meet them there and we take it from there. But I feel if I create an environment in which they feel safe and open, and sometimes it's about just loving touch and not talking about it, a person can open and experiment and surprise themselves. And so that's part of being a healer, I think. And the word physician actually means to be an educator, right?
Do you use acupuncture, and what other modalities do you use in cancer treatment and treatment of other disease?
Well, I always use acupuncture if the patient is local. I do a lot of long-distance consulting, so if I can, I do acupuncture because you can really, really open up the liver, you can calm the spirit, nourish the heart, you can deal with inflammation and pain, you can really open up the emotions. You can really do a lot for people, and so I like it. It's a beautiful tool, but it's not necessary. I actually think that the herbs and the supplements and the lifestyle changes and the food is crucial. Acupuncture is a luxury, but it's profound if you can do it. It's really profound. And then I also teach patients meditation so that they have a way to be able to cope with what's happening and be able to self-regulate and be able to find a way to be with their emotions.
Yes, so it really is a truly holistic approach, and you being able to merge the East and the West, really the best of everything to people is quite extraordinary, because even integrative medical doctors not familiar with Chinese medicine don't bring that beautiful piece to the table as you do.
Yes.
With all of our environmental toxins and plastics and packaged foods and EMFs, are there different types of cancers that are more prevalent now?
Well, the most common cancers in the United States are breast, prostate, colon cancer, and lung cancer. So all four of these cancers actually are driven by exposures to environmental toxins. So if you think about it, if you have a digestive tract cancer like colon cancer, cancer of the large intestine, then all your food, everything you put in your mouth, passes over that tissue and therefore may change it. And so there's exposure there. In the lungs, you're inhaling whatever in the air you breathe. And so that is why the lungs are vulnerable. And then breast cancer and prostate cancer are in fatty tissue. And many cancers arise in more fatty tissues like the bone marrow and the liver examples also. And most of the toxins in our modern world dissolve into fat. And so wherever you have fat in your body, including your brain, is mostly made of fat, then you'll have a higher concentration of these toxic chemicals in those tissues.
Why is breast cancer on the rise? I mean, cancer in general, I guess it's just a perfect storm of everything. You know, the environment, the food, the stress that people are living with, the technology, it's just a different world that requires, and it induces a lot of stress, perception of stress in people. But in your view, why is there so much more cancer, and why are certain cancers like breast cancer so much more prevalent? Because of the toxins that are going onto the receptor sites of the... There's a couple answers to that question. Number one, a lot of the toxins in the environment act like hormones, right? Mm-hmm. Plastics, parabens, which are in our personal care products. So you want to be mindful of not storing your food in plastic, storing it in glass containers, drinking water out of a glass water bottle. You want to be really careful about your body care products because there are a lot of hormone-stimulating chemicals like parabens in our body care products, shampoos, lotions, toothpaste, cosmetics of all kinds. And so you want to attune to and find the companies that have made a commitment not to put those things in products, because a lifetime of use is a lot of exposure. And so women in cosmetics often have much higher exposures than men because of all the stuff we put
on our skin. And so these things that act like hormones do bind to estrogen receptors. So on the cell surface, there's a little receptor, and like a lock and key, something will fit in there and then turn on a process in the cell. And so if you have things that bind to estrogen or act like estrogen, you get more cell growth, more proliferation. And so this is a big factor in estrogen and hormone-driven cancers, which includes prostate cancer.
Right. Now, what do you think are some of the other ways that everyone needs to hear about to outsmart cancer that we haven't covered yet? You've covered diet and some supplements. What are some other key points that people can take away with them to start on this preventative lifestyle?
Well, let's talk about things anybody could do.
Yes.
So you have to get 7 to 9 hours of sleep every night because you're a mammal. And so you have to sleep at night. Sleep when it's dark, be awake when it's light. And so trying to skimp on sleep or being proud because you can get by with 5 hours of sleep really damages your immune system. And so you'll have a higher risk. We know that pilots and stewardesses have higher risks of cancers because they're always crossing time zones and out of sync with the sun. So very important. And there's a lot of research on exercise, and it's not a lot of exercise. 30 minutes, 5 days a week, 150 minutes a week is the minimum. More is better. Right? But anybody could take a walk for half an hour, 5 days a week, and transform their immunity. A lot of studies have been done, particularly with breast cancer survivors, that decreases the risk of a recurrence dramatically, just doing that little bit of exercise. And the other big thing is blood sugar. So if you have a higher blood sugar because you eat a lot of sweets, a lot of fruit, a lot of sugary things, you drink a lot of Coca-Cola or carbonated sugary beverages, things with high fructose corn syrup, then you are going to have a higher blood sugar, but you're also going to have a higher insulin, because every time we eat something sweet, our body releases a hormone called insulin, and that's how the door on the cell gets opened so the sugar can get inside the cell and be fuel. If that doesn't happen, you build up sugar in your blood and insulin in your blood, and that is an environment for rapid cancer growth.
Yes, so we need to sleep, which is often overlooked in our society.
Yes.
It's really
Yes.
not valued.
Yes.
As you say, many people pride themselves on needing less sleep so they can get more done.
Yeah, backfires.
And you see this in your patients?
Oh, yeah. I mean, we all know you can't even think straight if you sleep 5 hours enough nights in a row. So we know that we don't function well. But also, if you don't sleep enough, you get into a physiology where you store fat. Having more body fat increases your cancer risk. If you don't sleep enough, your blood sugar and your insulin go up. That gives you a body which makes cancer thrive, right? So sleep has a big impact.
And you mentioned at the beginning also, I believe you mentioned attitude. Let's talk about that. How can people be in gratitude and frame their lives in a way that can lead them to a healthier preventative lifestyle, or if they're in a disease, to help them to heal?
Well, there's the word resilience. And I think that is something more innate and natural to some people than others. But whenever there's a big life challenge, it's an opportunity to develop something in ourselves. And so people who see the cup half full, who look for the beauty and the lesson and the gift in an experience, no matter how painful, do better because of the chemicals in our body that are produced when we feel at ease and at peace or grateful are very different than the body chemistry of fear and despair and depression. And so we have to be compassionate towards ourselves and allow ourselves to have all feelings, but also to have the capacity to move, right? Not get stuck in a certain emotion.
Right, so spending time in gratitude every day, meditating every day, I guess these would be good small things that don't take very long, but do you find that they add up to make quite a bit of change in people?
I think so. I actually like to teach kids, like if you have children who are sick, you can teach them to think of 3 good things that happened that day, right? Anybody can do it. Anybody can do it. There's actually a practice that's done in Zen monasteries in Japan, where at the end of the day you write a 3-line haiku poem that captures the essence of the day and has a nature metaphor in it. And so it causes you to reflect. It causes you kind of to step out of your linear thinking because you're in poetry. And it causes you to think of nature, which gives life. And so it's a very beautiful practice also to kind of turn you to where you might hang out habitually. So there are methods, right? There are methods. There's David Steindl-Rijst is a very well-known Benedictine monk who teaches gratefulness. And he's very funny. He says, you don't have to turn your body into a pretzel and do yoga to feel better. You can just be grateful.
Very simple.
Yes.
We can all do it.
Yes.
It's free. We can do it every day. It takes moments.
That's right.
But really, it is said that it's just the results are very profound from doing that.
Yes, they are. And some things are just habits, you know. And so it just takes practice. And it just takes reminding oneself. And I always say to patients, just do the experiment, you know, see what happens. Just humor me for 3 months and see what happens. You know?
Right. Do you often find, you talked about seeing the blessing in it, seeing the positive, learning, growing from something, seeing the beauty in it. What do you find when patients are able to work with you, heal, and then come out the other side? Do they often, because I've heard cancer patients say, well, it was really a gift, because they changed their whole life. They changed their attitude, or it led them onto a new path. They were not on a healthy path to have developed cancer to begin with. So what is it that you see?
Well, it's surprising and paradoxical to hear someone say cancer is the best thing that ever happened to me. But actually, people who take it as a journey and take the challenge as an opportunity to grow, to explore, to experiment. And some people, you know, end up really thinking about what has the most meaning, what's the most important to me, and feeling, because they're in this situation, they get to make those choices where they might not have given themselves permission before, or it's so crucial to their healing that they get out of a bad marriage or leave their job or stop eating junk food, that the edge of cancer gives you this opportunity to wake up. And so some people take that opportunity.
Wow, that's very inspiring. And I know you want to let people know how they can find out more about how to outsmart cancer.
Yes. Well, I have a lot of free information on my website, integrativecanansweranswers.com, and I have lots of recipes. I have 4 different handbooks that tell you how to walk through each part of the journey. So please come and join our community there. There's lots for you.
Thank you so much. There is, I can attest to that because I read your information. I look forward to it. So thank you for being with us. Thanks for helping us to learn how to prevent what has become an epidemic and hopefully turn it around. The more people that can gain this knowledge, the simple changes that we can make. It does take a commitment, as you say, but little changes make big differences.
It's powerful. It's very powerful.
It is. So thanks for sharing it with us, and we thank all of you. Be sure to check out Dr. Nalini Chilkov's resources, and be sure to join us next time on the Cancer Answers Global Summit.